Makerere University School of Public Health, as part of the Future Health Systems Consortium, has been implementing a community scorecard study in Kibuku District in Uganda. And during our implementation, we have faced some challenges at the different levels of the scorecard development that we would like to share. These challenges could be shared in different communities that could be implementing the scorecard. However, they can also change depending on the context you're working in. It is worth sharing them so that as you implement the community scorecard, you have a heads up. In this video, we list the challenges according to the steps that are involved in preparing the scorecard. So in the first step, which is preparatory groundwork, we can find challenges of misconception about the community scorecard. People think that sometimes it is a tool for blaming health workers or service providers for poor performance. Sometimes the health workers think it is time to blame the communities for poor health-seeking behavior. However, how can you go about that? You need to do proper sensitization of communities on the objectives of the community scorecard, as well as the health workers, to understand that it's about improvement and not a blame game. When you're selecting the facilitators for the meetings, sometimes you could encounter challenges like people being selected not having the right skills or qualifications as facilitators. Sometimes network relations influence selection processes. The facilitators selected could also be people in the community that have never done any volunteer kind of work, and yet this is a voluntary call. Sometimes people think it's a paid job. How did we go about this? We made the criteria for selection of facilitators very clear with the qualities we seek in the facilitators. You need to make it clear from the beginning that it is going to be purely voluntary work without any pay. And it's important to note, however, that the facilitators may need some transport if they have to travel long distances. You need to select facilitators who are mandated to carry out other tasks as part of their daily jobs to minimize the need for extra pay. What about immobilization? You might face challenges of communities refusing to come to the meetings if there are no allowances. Minority populations, like the elderly, people with working disabilities, their docents, may be left out. How could you go about this? You need to do proper sensitization of communities on the objectives of the community scorecard and its value as a tool to improve service delivery. The persons who do mobilization should be reminded to mobilize all community subgroups, including minorities. Let's go to step number 2 and what challenges we might face, and that's health facility scoring. The health workers may be too busy to attend the scoring meetings, and some health workers view this as a fault-finding tool, while some health workers may consider it as an extra burden. So what could you do about that? You need to explain to the health workers that the usefulness of the scorecard is for improvement of accountability, service delivery, utilization, and promotion of positive practices. You also need to schedule the meetings during off-peak periods when the health workers are not very busy, and link the community scorecard implementation with other quality improvement efforts. Let's look at the challenges that you might face in the community scoring, which is our third step. Communities are tempted to ask for what is beyond the norms of their health facility. They also sometimes tend to score indicators that concern their input as doing very well, and those that concern the health facilities as doing really badly. What can you do to solve this? Ensure that the community members know the services that are provided at each level of service delivery. That's why it is important to give them a good explanation of the input tracking matrix. Explain the importance of being sincere while scoring to allow for proper evaluation and improvements, and trust. Let's look at what we might encounter in interface meeting. Sometimes facilitators of the community scoring meetings forget to carry scorecards and work plans for the discussion, or even other materials that they need for writing. In some meetings, the health workers who are supposed to interface with the communities may not be available. The technical leadership, political and other stakeholders may also be missing in the meeting. In some cases, very small numbers may turn up for the meetings from the community. Sometimes community members expect some form of payment from the meeting, but also there is poor participation of community members. How could you solve this? You make sure to schedule with the health workers in advance so that each interface meeting will have a health worker in attendance. Invite the political leadership, technical leadership, community, and other stakeholders like implementing partners days prior to the meeting. Explaining the meetings will involve no payment, and the door-to-door mobilization by the local council ones and the village health teams helps to improve turnout. Ensure that the facilitators have adequate facilitation skills and encourage the communities to have problem-solving mindset. We shall now look at the challenges that you might face in your last step of developing the community scorecard, and that is the dissemination, advocacy, and monitoring step. Advocates commit to undertake some activities, but sometimes don't do their job. The local communities cannot solve some of their problems. What can you do to solve this? Ensure tasks to be undertaken are feasible and clear. Follow up with the advocates on their progress for each activity. Lobby for support from the local and national government, civil society organizations, and other partners to improve service delivery and utilization. These are some of the challenges and how we try to go about the challenges as we implemented the community scorecard. However, you could face more challenges or less challenges depending on the context where you're developing your community scorecard. Thank you.